So in schizophrenia, the patient has one of the characteristics behavior are the catatonia. So here I'm going to show you about the catatonic behavior, but it is important to know catatonia, it is a neuropsychiatric disorder which is affected behavioral or motor functions. And catatonia, the patient who have it, we have to evaluate what are the underlying cause. Also commonly observed, the symptoms include like stupor, lack of verbal response, or patients sometimes hesitation or rigid body posture. So let me show you.
Catatonia is a state of increased muscle tone at rest.
So increase the muscle tone at the rest, right? So the diagnosis involved the performing test to rule out other conditions and also comparing the symptoms with the standard manuals,
which is abolished by voluntary activities and therefore distinguished from extrapyramidal side effects. In these clips, you'll see a variety of forms of catatonia demonstrated by a role player being examined by a psychiatrist. This clip shows force grasping, where a patient is unable to comply with instructions to resist a preferred handshake. Characteristically, the interviewer has difficulty getting his hand away.
Move your arms around a little bit, is that okay? Okay. Okay, just leave go.
you see.
Relax a second.
So muscle tone increase. This is a neuropsychiatric disorder and affects the motor function.
What I'm going to do, I'm going to put my hand out, but I don't want you to shake it. Okay, okay, leave go. Think carefully about what I'm asking you to do. When I put my hand out, as though I'm going to shake your hand, don't take it. I do not want you to shake my hand this time. Okay, okay, that's fine. Just try and relax for a second.
In this clip, waxy flexibility is demonstrated when a patient's limbs are placed in an unusual position, where they remain for a sustained period.
I'm just going to move your arms gently. Okay.
So patient can stay this abnormal position for a long time. Sustained abnormal position or posture. So catatonic behavior or this type of abnormal mood disorder, what are the causes? The accurate cause is not completely understood, and it is attributed to irregularities in neurotransmitter level. And it is also associated with mental illness like mood disorder, like schizophrenia, or medical condition like infection or exposure to the toxic and severe vitamin B12 deficiencies. The side effect of certain medication we used to treat mental illness sometimes causes it. Withdraw from medication like clozapine or brain abnormalities, right? It is also important student must know what are the risk factor include, like gender. The women are prone to develop catatonia. Also, age is a factor. Age, like old person, are high at the risk to develop catatonia. Also, hyponatremia, like low sodium level in the brain, sometimes lead to catatonic behavior.
You said that you feel that there's something not quite right. You're having some difficulty explaining that.
The patient in this clip is displaying opposition, resisting all attempts by the examining doctor to move his arm.
I'm just going to move your arm gently. Just let it come with me. Okay? Okay, that's fine. That's fine. I'll try and pop it down this way now. Okay. Okay, that's fine.
A more intense form of opposition is negativism, where the patient actively resists all attempts to make contact and also, in this clip, displays aversion by turning away from the examining doctor.
I'd like you to just shake my hand. Okay. And shake my hand, Peter.
Aversion.
Okay, we'll leave that for now.
Are you single? Maybe.
Okay, so here I want to tell you, if patient have this kind of catatonia, what are the treatment options? The treatment include the medication and electroconvulsion therapy. What is that? What does it mean, electroconvulsion therapy? Electroconvulsion therapy is the therapy include the induction of seizure electrically in the patients to improve the symptom and is preferred when psychotherapy does not work.